everyone. I'm so glad you joined us this evening. There's so many things that people deal with when they're a caregiver. And one of the things that they deal with is how to understand what's going on with the person that they're taking care of, especially if you have dementia. And doing this podcast, I enjoy meeting so many people that tell their stories, but also so many people that are working in the field to help caregivers. Today, we're going to hear from someone who's been in the field for a long time. He is a nurse that works in geriatric care and also is developing something that is going to help caregivers better understand their person that has dementia. So please listen today and make sure you like, comment, share, and subscribe. Autumn is here. Hello, everyone, and welcome to my show. Autumn is here. I am your host, Francine Crawford, and today we have a special guest, Ab Brody. He is from New York University, Rory Meyers College of Nursing, and he's going to talk to us a little bit about dementia and the new things that are coming up. So let's welcome him to the show. Welcome, Ab.
Thank you so much, Francine. It's so wonderful to be here with you today.
It's so good. Thank you. I appreciate you coming to share some information with us. But first, let me hear a little bit about yourself.
Of course. So I am a nurse and a nurse practitioner in geriatrics and palliative care, and have been providing this type of care for over 20 years now, which is where I've gotten my inspiration, in addition to having multiple family members who have had dementia and other neurologic illnesses over the years. So I've had both the personal and the professional focus on helping people with who are caring for this illness for the last 20 years, both through research and in the real world of, practice and providing support.
Oh, okay. Okay. So you took some of what you have experienced and now
Yeah.
you work with that and you're able to help people in that. Oh, okay. Okay. So what is it exactly that you do at New York University Roy Center?
Yeah, so I am a professor. I both practice in our NYU's health system, and I teach nursing students, and I also develop programs that are meant to help support caregivers of persons living with dementia and the person living with dementia themselves. And so what that means is I take all of the things that we know that we've shown to work and try to help them get them into the hands of whether it's healthcare clinicians and teams who really don't get a good education on how to care for this patient population, and directly, more recently, into the hands of caregivers specifically. Because from a personal experience, I've found that when we go through the health system to help people, oftentimes that misses a lot of people who aren't connected to the health system or aren't connected to a highly capable health system like NYU health system. And so really trying to get more directly to caregivers to help them manage the illness without having to intervene with provider visits and kind of all the other challenges that sometimes come with trying to connect yourselves with a dementia-friendly clinical team, which there are very few of.
Okay, so what are some of the specific challenges that you deal with in the industry?
Yeah, so I don't think we do a good job in healthcare in helping to teach nurses and physicians and all different types of disciplines how to provide effective care. And so what ends up happening is people go to their primary care provider who learns very little about dementia in their training. And there aren't really great medications to stop dementia other than to slow it down if you're dealing with cardiovascular effects like high blood pressure, high blood glucose, diabetes. And so we end up with ineffective medications being given that can actually make things worse. And so I spend a lot of my time, both as a clinician, as a nurse practitioner, as well as a researcher, trying to get people to stop those medications that are ineffective that many of your listeners may have received for their loved ones or the people they're caring for, like antipsychotics, and instead provide evidence-based medications and non-pharmacologic strategies that actually do work and can improve the quality of life and reduce stress for caregivers versus just sedating the person living with dementia, which isn't great for them and isn't great for the caregiver because then they wake up in the middle of the night and
Mhm.
then the caregiver is up in the middle of the night. So I try and now bring a lot of that directly to caregivers in addition to educating and trying to change the healthcare system itself.
Okay, that's very interesting because one of the things that interests me is to educate the healthcare system and get a communication with people who are, you know, older or bringing their parents or stuff like that because you don't know what to look for. And if if the healthcare person is able to assist them and say, okay, well now you should do this, or maybe you should look into that, or these are the things that may happen. Like they don't go further with certain things and certain information. So that's great that you're trying to do that and couple that with also with the caregivers. So what are things are you working on that will help in this situation?
Yeah, so one of the things that we're working on right now specifically is to empower caregivers to implement evidence-based practices around behavioral symptoms. So, the things that tend to stress caregivers out the most and create challenges that get in the way of the positive aspects of caregiving and helping someone that you really care for, like wandering or agitation or aggression when you're trying to help someone. There are a way to address those without using medications, and medications actually aren't shown to be really effective for most of those things. So
Mhm.
what we're trying to do right now is build a way to scale that to caregivers. How do we help caregivers to identify the main symptoms and then to use those evidence-based strategies for those symptoms? So we right now have started to develop with an advisory board of caregivers a mobile app that sits on your phone, your Android phone, your Apple phone, and does a quick little assessment that takes about 5 minutes, just by answering some yes, no, and true, false types of questions. And then says, we think you should be treating X, whether X is agitation or wandering or sleep problems. The app itself helps to guide you as to which one of those problems might be the one to treat first. And then says, hey, here are the things that work for this. Which ones would you like to implement? And so it both empowers the caregiver and gives them choice as to what evidence-based interventions they might want to use.
Okay, wow, that's exciting. That's exciting. So it's a mobile app. So you would
Yeah.
download it to your phone and then it will be specific to your needs. Once you fill out the information, then it's specific to your needs and your needs of the person that you're caring for.
Exactly. And it gives you choice and it allows you to log and show which interventions you're implementing on which day. It gives you reminders. So it's trying to help keep you on track because it can be so easy to get frazzled or stressed out as a caregiver, right? Because you're getting pulled in so many different directions. And so it's not one of those things where it's like pinging you every 3 seconds and then you get frustrated and you delete it off your phone. But it's one of those things that'll give you a daily reminder. Have you tried these things and how are things going? To help keep you on track and really give you a little nudge to say you can do this.
And is that information private or do you use that for research?
So right now, the way we are using it is for research. And by research, it means we're trying to make sure that this works for the people that we're trying to care for, right? So for our initial launch, we're not like a Silicon Valley company we have to go through all sorts of regulations to make sure that your data is only being used for this scientific process and that it's kept private. And so nothing is going anywhere outside of our group, and mainly to see how the app itself works.
Okay, so this is kind of like a trial to see how it works and see how people respond to it,
Yeah.
correct? Oh,
Yeah. And in the end, our goal is that if we have enough people using it, we'll
mhm.
see what people like and what people don't like, and then we can make it better. So the people that start on the ground floor with us are really helping to inform not only how they're providing care, but then how they can give back to help other caregivers in the future, whether that's through their data informing how the app decides to recommend things or suggestions that they provide back to us to change things. We really want to work with people in the community to make this what they want to help care. So even in the first couple of, our advisory board, for instance, they asked that we add journaling to this. So we're adding journaling to it. And we're really responsive to try and meet the needs of the people that we're trying to care for.
Okay, so when do you think it would be ready for people to, well, I guess it's testing first. So
Yeah.
is it, how do you get to be a part of that?
So you just have to contact us. We are recruiting right now to have people test this out. We have a email that people can email. It's Aliviado, Aliviado dash caregiving at nyu.edu. And so once people send that email, and we'll include this with you for the show notes, then they can be enrolled into the program if they're eligible. We actually do provide payment because you're helping us. And so we want to make sure that this is a partnership that we're both learning from you, but also paying you for your time and helping us. And so we go through a whole process to make sure that you're comfortable with what we would be, how we would be working with you on using the app and testing it.
Okay, so how do you qualify?
We are looking at individuals who are caring for someone who have more than one symptom. So that could be agitation and sleep problems, for instance, and are from communities that typically have not been well served by the healthcare system, because our goal is really to first take it to the people who need it most. So we're talking of individuals who have been historically discriminated against in healthcare in the United States, individuals from rural settings where there isn't as much healthcare at all. And so those are really the primary qualifications. And then once we've enrolled, a number of people to test it out and make sure that it works the way we think it should, we're going to open it up so that other people can use it as well. So we're going to do both a study and then open it up on the app stores so that people across the country can gain access to it.
Okay, so let me ask you a question. How long do you think that you would, if you're on a trial basis or trying to work with you in this research part, how long are you going to do that part?
Yeah, the trial is only 4 weeks. So we're
Oh,
looking for people to go through one 4 week cycle where
okay,
they answer some questions. They then use the app for 4 weeks and we ask them some other questions. But then they'll be free to keep using it as long as they find it useful as well. So we're not going to shut it down or take it away from anyone if they sign up for the study as well.
okay. Oh, that's awesome. That's awesome. So, in your experience with dementia, what do you hope for, and what do you see like that is something that is an improvement or something that you are hoping that is going to be a breakthrough?
Gosh. In the long term, I hope for a cure, right? As I think we all do. But I think what's really complicated is dementia isn't one illness. It's multiple different illnesses. And so I think it's going to take some time to really get there, even as science advances. What I can hope for in the shorter term, though, is that we have more effective treatments to help with the effects of dementia so that we can better support people.
Mhm.
So, sometimes it could be drugs, but a lot of it is going to be non-pharmacologic. So, Francine, I know you cared for a loved one as well. One of the things that I think we really underuse is the things that are um, important to who we are, right? We think that people forget who they are as they develop dementia, but they really still have that essence. And then we use that to help treat the symptoms that come up. So for instance, I know one of the treatments that has the most effectiveness of any intervention out there, better than drugs for the most part, is music,
Uh-huh.
right? So with a lot of the people that I care for and coach as caregivers is uh, not necessarily music therapy, but because that requires a trained music therapist, and sometimes that's hard for people to obtain, but music as a therapy. So that can be playing music that someone likes and then dancing or reminiscing to that music. There's research that shows that if you dance with that person or play their music that they love for half an hour a day, about the same time before they might, get agitated in the afternoon, let's say, that's going to reduce the agitation.
Okay.
And so, what I would love to see and what I think the breakthrough is actually implementing the things that we know work already, like music, like reminiscing about things. If people can't remember what's happening now, but they
Mhm.
remember when they got their first dance after their wedding 45 years ago. And so, I think it's the power of getting those things actually used and into the hands of caregivers that's going to be the biggest short-term breakthrough.
So your suggestion is not just to rely on medicines and different things like that. It's there are other things that you can implement. And that's good for caregivers to know because sometimes if you go to a doctor that they're going to give you medicine and you're the one that's watching the person and seeing how they react and things like that. So it's good to know that you can implement some things that that is outside of medicine. So that's
Yeah.
great. Yeah,
And I
that's
think medicines can sometimes make things worse too.
right.
They can make people sleepier, they can make them more confused.
Hmm.
And I would never say to anyone that you should just take them off whatever medications they're on, because that can be dangerous too.
Hmm.
But really thinking through, sometimes medications can be a little bit helpful, but a lot of times the medications that people put on are harmful and make things worse. And so I think that we need a better balance and much more focus on these non-pharmacologic strategies to help improve how caregivers can care for the people they're caring for and how persons living with dementia feel um, uh, even if they're still having moments of struggle.
Hmm. Okay. And these are things that the caregiver can do. Is you don't have to call in someone to do. It's things that
Exactly.
they can learn themselves and they can help in that way.
Yeah. And I think the other thing along with this is that when you're doing these types of interventions, there's meaning that goes in it, and it's a positivity versus if you're trying to help someone get to the bathroom and they're struggling against you, that could be a negative interaction. And just like in a marriage or a relationship, or when you're taking care of your kid, if you have many, many negative interactions, you need 10 times the number of positive interactions to counteract that, right? And so if we start from a place of positivity, it makes those frustrating moments much easier to bear. And so these things can create connection, right? If I'm dancing someone, if I'm reminiscing about times past, that those are things that can create this connection between you and them that increases the positivity and can reduce some of that the challenges that come from the harder moments.
Okay, yes, awesome. That's great. That's great. Well, is there anything else that you would like to share with the audience that may help them or something that maybe people don't know and don't realize and can take advantage of?
Yeah, I think one of the other things that is out there that folks may not know about is that we have a lot of community resources for people, but they're often not put out there. So, for instance, here in New York City, we have Caring Kind, which is a organization that's dedicated to supporting persons living with dementia and their caregivers. More broadly, there are other programs nationwide. We have senior centers and adult day health. So there are all these community-based organizations that can provide supports for people who are, don't have enough income for food. They provide food. They can provide respite during the day for caregivers that just need a few minutes to themselves. There's so much out there through adult day health, senior centers, area agencies on aging. So I think there's all the there's more there in this country than I think people sometimes realize, both in terms of the non-pharmacologic things we can do to help in caregiving, as well as supports in the community.
Okay, awesome. Yes, that's good to know. That's good to know. Well, thank you so much. Thank you so much for taking this time and sharing with us and giving us some information that's helpful. We'll definitely put out the email. So if anybody's interested in being part of the test of the mobile app, we'll definitely put that out. So encouraging people to do that so you can get the best results possible. So
Thanks so much, Francine, and it's been wonderful to be here with you today. And I hope to come back sometime and talk about other strategies that caregivers might want to consider when they're working with the people that need their help.
absolutely, absolutely. Thank you so much. I appreciate it. All right. Take care.
Take care. Bye.